Good morning. Thank you for being here. My name's Katie Earle. I'm the coordinator of the University Express program, and I work for the Erie County Department of Senior Services. And we're joined here today with Lynn Riker from Hospice and Palliative Care Buffalo. Welcome, Lynn.
Good morning, Katie.
Thanks for being here. So let's jump right in here. We'll thank the sponsors of our program. It's my Department of Senior Services, Blue Cross Blue Shield of Western New York, Excelsior Orthopedics, and Wegmans for all of their support. And if you ever need anything from us or you're not sure where to start, please give us a call at Senior Services. We're at 858-8526. So let me introduce our speaker today. Lynn is the Director of Outreach for Hospice and Palliative Care Buffalo. In her leadership role, Lynn oversees community and clinical engagement to increase awareness, education, care access, and caregiver support for those faced with serious illness. Understanding that many hesitate to talk about illness and healthcare preferences, Lynn strives to assist those that need help advocating for the right care at the right time. Lynn is a native of the Buffalo area and is passionate about providing support to the most fragile in our community. Lynn, please, the floor is yours. Take it away.
Thank you, Katie. Good morning, everyone. As Katie mentioned, I am the Director of Outreach for Hospice and Palliative Care Buffalo, and one of my roles is to assist those in the community that are seeking how to better care for themselves, how to care for a loved one that may be struggling with illness. And given the times that we're living in now, those are concerns that we all have. Many of us are overwhelmed and stressed. And hopefully today I can give you some tips that will be helpful to you, your loved ones, your family, in kind of managing all that's happening. Sorry about that. Okay, so the first thing we always have to remember to do is take care of ourselves, because it's one of the most important things we can do, especially given that most of us are caregivers. And this is a rough one, because we all dislike it when someone says, just breathe, just take a breath. It can be so frustrating. But truly, if someone tells you to breathe or just take a breath, while it's infuriating, but it truly is good advice. It gives you a moment to switch your thoughts to yourself for a moment and to concentrate just on your breathing. If you take a few breaths and exhale slowly, kind of do a mental scan of your body to feel what might be tensed at the moment. Concentrate on just refocusing, concentrate on loosening up. Better manage stress can really help us be more mindful of our own needs, but also to be more meaningful in our caregiving. So though it can be frustrating, it truly does work. Of course, when we are caring for someone and caring for ourselves and caring for others, we have to be mindful that we have both internal challenges and external challenges. And what I mean by that is, internally, when we're trying to care for a loved one, we're probably emotionally drained, probably incredibly exhausted. Caregiving is incredibly stressful. And it can be challenging to maintain balance because of all the needs, all of the requirements of our day, and all the requirements that others have and are expecting of us. Oftentimes when we're caring for a loved one, the person that we once knew might seem or be very, very different, might seem like a different person. So we have to be mindful that, yes, we are drained, we're exhausted, and we're stressed. And we have to try to, if we can, put things into a perspective that will help us forge through the day. But in addition to all those internalized feelings, we also have external caregiving challenges, meaning the physical requirements that we might need to care for a loved one, meaning there's oftentimes a loss in routine, and there's increasing needs of activities of daily living. And what I mean by that is just to help those have assistance when they might not be able to dress themselves or feed themselves. So there's all these external needs, especially as diseases progress. So what do we do? How do we try to go about a day? Again, monitoring our breathing can be helpful. Enjoying your morning cup of coffee. I know for me, I have to have that morning cup of coffee to start my day. Many consider meditation or consider a physical activity, and that helps them be mindful about how to start their day. And partake in an activity that allows you to hit the reset button, whatever that might be for you. Again, it could be that coffee. For me, it's that coffee. For me, it's sitting down doing a few puzzles in the paper. It can be any host of things, but just a few minutes to start your day in a mindset that will get you able to focus, to relax, and to be ready to try to forge ahead. Actually, genuine self-care requires intention. And what do I mean by that? To ensure that you're taking care of yourself, to ensure that you're ready to take care of others, you really do have to take care of yourself. And I think a perfect example of that is when a flight attendant says, secure your own oxygen mask before assisting others. Because we have to be prepared before we can help others. We need to give ourselves permission, again, to do something nice for ourselves, whether that's, again, a cup of coffee, a quick chat with a friend. We have to consciously tell ourselves that we're doing something healthy for ourselves, again, to start the day. And we have to refocus and reorient ourselves back to where we want our mind to be. Another huge thing is that when we're caregiving and or trying to do our best to care for ourselves, sometimes it can be overwhelming because, again, the stress, that we can become a bit irritated and frustrated. And that can be addictive because that can, again, overwhelm us, and we may have negative thoughts. The daily stuff that we deal with as caregivers sometimes is not so pleasant. The stress and demands placed upon us often present what we feel is problem after problem, and sometimes it's hard to find solutions. The mountain of problems and the difficulties can seemingly fill our lives. And when we're faced with all of these challenges and these thoughts, we often train ourselves to see the negative, which leads to even more exhaustion. So to try to work through that, we have to understand that the addictive nature of irritation and anger and frustration and negativity can be very difficult. And we have to think, okay, how are we going to refocus so that we can forge ahead? So here are some tips to do that. Some people enter a to-do list on their calendar. Some people set a reminder on their phone. Some people write things down, but remind yourself to find something good in your day every day. Even when things are really incredibly overwhelming, there are positive things that we can take a moment and focus on. We have to try to count our blessings and carve out a few minutes to think of something positive and make a conscious effort not to fall prey to the addiction of negativity. Another important thing to do is to situate yourself in the present. This can be the most emotionally difficult for all of us. Intellectually, we can understand an illness, and we can intellectually understand that caregiving is challenging. But emotionally, we often lag behind the understanding of these challenges. There are experts out there. There are counselors and social workers and therapists. We all have close friends and a network. You want to be sure that you can have others help you gain perspectives on what you're dealing with, and they can provide you with caring support and tips when we're struggling. Another thing to help you be situated in the present is to think about how. How do I situate myself in the present? How do I make it through today? Well, When it's possible, try thinking, my present is not my permanent. This is a moment in time. Know that the situation you're in at this moment will change, and realize the benefit of taking things one step at a time. Try to make everything a little bit more manageable today, a little bit more manageable tomorrow, a step at a time. Others often can say, take a litmus test. And there's a threefold litmus test that would maybe help you refocus today. When something is going through your mind and you feel yourself, you know that you're stressed, that you're anxious, or maybe angry or upset, stop and ask yourselves these three questions about how you're thinking and how you're feeling. The first question is it true? The second is it helpful? And the third is it kind? And let's talk about that. So the first, is it true? Again, when we're overwhelmed, we have to think to ourselves, is your thought is it really legitimately true? Sometimes, as we get upset, our thoughts are not always true, or they may not be accurate, again, because we're overwhelmed and stressed. But if the answer is yes, then okay, go ahead, keep on thinking it. If the answer is no, try to consciously let it go and move on. Is the thought helpful? Just like the first question, if it's helpful, allow it to stay in your mind, work through it. If the thought is not helpful, again, try to disregard it and move on. And the third, is it kind? This is a tough one because we often miss this part, because we forget that we have to have self-compassion and we have to feel kindness to exude kindness. Kindness is one of the most important pieces of the puzzle for caregivers. If your thinking is true, and if it's indeed helpful to you, then ask yourself if your thought is kind. If it is, allow that thought to sit in your mind and actually relish it. It will help you and nourish you in some way. If it's not kind, then try again to let it go. It might seem complicated or maybe a bit silly to ask yourself such questions about your own thinking. However, working through this process can diffuse a lot of that anger, agitation, and frustration. So again, is it true? Is it helpful? Is it kind? Is it worth thinking about? Communication, this really should say loved ones communication, but when we're faced with our own personal challenges and when we're faced with caring for others, oftentimes communication is one of the most important things to focus on. You have to remember that it's always important to talk and to communicate. Find creative ways to maintain some normalcy in your relationships. Again, continue to take care of yourselves. Be mindful to take care of yourself. Most importantly, if you can, keep your sense of humor. Sometimes that can be the greatest sense of relief for us, is to keep our sense of humor and to be light when we can. Make conscious decisions about the things you can change and the things that you can't, if you can let go of them. Put your loved one's illness in its place and keep it from becoming maybe the sole focus of your life, although it oftentimes can be, but there are other things that we can focus on. Again, that minute for ourselves, that cup of coffee, the quick conversation with a friend. If you can, avoid pity. Avoid pity to yourself, but also hold your ill loved one accountable when you can. They still sometimes are able to be responsible for their own actions, and to the fullest extent possible, we want to have them accountable. We want to try to let go of the pity if we can. But most importantly, we always want to be patient, not only with the patient or loved one we're caring for, but to be patient for ourselves. We also want to realize that family relationships are always in flux, right? We all have different problems each day. We have different focuses each day. Sometimes some of these challenges are not just caused by the disease. They can be caused by external factors. Again, there are many support groups out there that can be social outlets and networks to you and resources to you. And not just a place to talk about problems, but to talk about solutions. Treat your loved one with respect and expect respect in return. If you can, begin to dream again and begin to focus on the things that are positive. By keeping all these things in mind and working at your relationship with your loved ones and with yourself, while recognizing limitations, you might find strength in spite of illness. The caregiveraction.org website is wonderful and gives great tips for all of us, because at any point, we're all going to be caregivers and we're all going to be looking for tips to help ourselves when we're helping our loved ones that have illness. Some great tips here that I'd like to review with you. You want to be sure that when you're caring for a loved one with illness, that you're seeking support from other caregivers. Many support groups are out there. For example, if you have a loved one that has dementia or Alzheimer's, you might want to reach out to the Alzheimer's Association. If you have a loved one with Parkinson's disease, you might want to reach out to the Parkinson's Association. There are traditionally support groups for caregivers that are those that are struggling with some of the same challenges that we are. Again, make sure you're taking care of your own health in every way that you can, so that you feel strong enough and well enough and confident enough to take care of the loved ones in your life that have challenges. Always be sure to accept offers of help. If someone offers to cook a meal, absolutely say yes. If someone offers to run an errand, absolutely say yes. Or don't hesitate if someone asks you, how can I help? Then maybe you can offer them some tips of how they could help you. Always take advantage of those scenarios when you can. Today, we're going to talk a little bit later about how to communicate effectively with doctors and other clinicians that might be helping you and your loved one. Caregiving is hard work, so when you can take a quick respite break, whether short, whether long, do some of the things that we talked about today. Maybe have a cup of coffee, maybe call a friend, maybe read a book, take a walk. Those moments of respite will help us to refocus. Watch out for signs of depression and don't delay getting professional help if you need it. Always talk to your primary care physician or your loved one's primary care physician to be sure that you're getting expert advice if you're feeling as if you need additional help. Be open to new technologies. Of course, we've all become experts. Look at us today. We're all on virtually. Many of us are reaching our loved ones and having virtual conversations. It's a change, but I think some of these things are going to stay in place for a long time, and even long after COVID. There are ways for us to connect with others, and we always want to seek any technologies or any ways that we can speak with the loved ones in our lives. Be sure to organize medical information so it's up to date and easy to find. Make sure your family and your loved ones know where medical records are and where information is should they need to get their hands on it. Make sure legal documents are in order, and give yourself credit. If you're a caregiver, you deserve kudos. Kudos to yourself and kudos to others in your life that are helping to caregive. It's a tough job, and it's a job that you really should appreciate and give yourself a pat on the back. So if you do have a loved one that has illness, or you yourself are struggling with illness, I need to tell you, it is never too early to start to have conversations. If you have a loved one that's frail or ill, it's never too early to talk about caregiving. For example, if someone in your life is ill, have you at all talked about home health care assistance, companion care, aides coming into the home? Have you talked about senior residences or assisted living or nursing homes? Have you talked about what might be needed by the patient and what the caregiver may need to be sure that you're having these conversations. These conversations are not easy, but you certainly want to think about what your needs may be in the future, because you don't want to be having these conversations in the emergency room or in the hospital. So any conversations and pre-planning that you can do, honestly, don't think of it as a burden. Think of it as a gift to yourself. Think of it as a gift to your loved ones. It is never too early to start thinking about it. I think some people will say, think and hope and prepare for today, but it's never too early to plan for what you might need in the future, because you don't want to do that in crisis. Difficult discussions. Most of us struggle, again, about having such conversations. Sometimes we worry if we have a loved one that's ill, if we bring up something that's stressful, it will add stress. And of course, we want to honor and respect the healthcare wishes of our loved ones, but we also need to encourage and facilitate honest conversation. Sometimes your physicians might be able to help you with that. Sometimes someone in your faith community might be able to help with that. You may have counselors or social workers or others in your life that can assist. But having these conversations, while they're challenging and overwhelming, you will be thankful that you have had them. Because of the uncertainties associated with illness, it's best, again, to have these conversations sooner rather than later. And I think we've all experienced some of that with everything that's happened in the community with COVID. People that we would never think would be impacted by illness have been impacted. People that we were worried because they were frail or ill before, we have more concerns now. Chances are your loved ones are thinking the same thing, worried about the same things. So these honest conversations maybe will be a little easier to have than what they would have been a few years ago. I think COVID has made us all a little more mindful that we have to be honest with ourselves and honest with each other and prepare for things that we might never have thought we would have to prepare for. Some tips for talking to healthcare providers. Again, if you have a loved one that's been diagnosed with a serious illness, it could be cardiac disease, it could be congestive heart failure, it could be pulmonary illness, it could be some type of cancer. But if you have a loved one that has an illness, be sure that you and your loved one have a list of questions that you're taking to any healthcare visits. Be sure to take great notes during the appointment, because we know when we're meeting with a healthcare provider, it's often a rushed situation, right? You have to cover so many things in 10 or 15 minutes. And you probably, without having that preparation, will forget to ask. So please be sure that you have your list of questions ready and that you take great notes. It's always okay to say you don't understand something that a doctor or a nurse or someone else has said to you. Always ask for something to be explained a different way, or try to repeat what they've said so that you can be sure that you're understanding it. If you feel the conversation's going too fast, or you feel, again, that you haven't absorbed everything that you need to understand, continue to ask questions. Questions to ask, again, when somebody has a particular diagnosis, you might want to ask what you can expect. So, doctor, you've told us that our loved one has congestive heart failure. What does that mean? What can we expect? What should we be worried about? Or how do we know that the illness is being managed? What do we think the future will hold? What questions should we be asking you that we're not thinking about? What are the symptoms I'm likely to experience or my loved one might experience? What should I expect over time? Again, have your questions ready. Be sure you understand. A lot of us will tend to go online and look at things, and certainly you can do that, but I would always make sure that you're talking to your own physicians and those that are involved in your particular care, and be ready to ask all of those questions. At times, again, when you have a diagnosis, there are questions to ask about treatment. Again, to know what your choices may be. We can't make decisions until we know all of our options. So be prepared to ask, doctor, we're faced with this illness. What are some of the treatment or surgery options? And can you explain to us maybe what we should be thinking about and how we should make some of these decisions? You might want to ask, is there time? Do we have time to reflect on what our options are? Do we have time to talk about treatments? And what will happen? Decisions. What will these treatments be like? What are the side effects? What can we expect as time passes? How do we know if the treatment is working or not working? Will there be other options? Again, these aren't all, when you have a new diagnosis, these questions might not be top of mind, but these are things to think about because you want to be sure if you're the patient or your loved one is the patient, that you're planning, that you're thinking about it, that you're sure that as a caregiver, you're prepared, but as we want to be sure that our loved one or the patient is prepared. Sometimes when you have a loved one or you yourself are faced with a challenging illness, or they call it a serious illness, some people call it an advanced illness, some people even say the word terminal illness, I need you to know there are many care options for those that have serious illness. And you'll hear the words palliative, you might hear the word hospice. Don't panic. Again, be sure to ask physicians and those involved in care all the right questions. Make sure you understand what type of illness you have, that you've asked questions about treatment, that you've asked questions about quality of life. Palliative care and hospice care are different, and many people think they're exactly the same because these terms can be used interchangeably. And I need to tell you, they are not the same. So palliative care is for people that have serious illness, but it might not be life-limiting. It maybe is somebody that has serious illness, and it could be early in their illness. It doesn't matter how old someone is. It doesn't matter their stage of illness. But when we have serious illness, oftentimes there are symptoms. Oftentimes there are burdens for both the patient and the caregiver. And there is help out there for people that are earlier in a serious illness, people that are seeking additional support, people that are wondering what their options are. You always want to be sure to check with your physician, to check with your insurance carrier, to find out what your benefits may be if you have a loved one with illness, because there is a lot of help before somebody is considering hospice care. Palliative care, again, is care for those that have serious illness. Again, it doesn't matter the stage of illness. It doesn't matter the type of illness, but there likely are symptoms. There likely is a need for more caregiving support. Many people that have serious illness are seeking ways to stay out of the hospital or to stay out of the emergency room. They need even more support above and beyond their primary care physician, above and beyond all of their specialists. They maybe need more education about their illness or need to start planning for what their needs may be in the future. The goal is to provide care in the home and to provide assistance to both patients and caregivers and their loved ones to try to navigate the challenges of illness, to try to help in making decisions, to try to discuss care options. Whereas hospice care is care for those that do have life-limiting illness, people that we believe may have months to live versus years to live. So it's for people that are later in illness, but it's care that's out there for patients for months, not minutes or hours or days, although, of course, we provide care in crisis. Of course, we provide care for people that have had a stroke or a car accident or a catastrophic injury. But for hospice care, it's really for people that have serious life-limiting illness. But it doesn't have to be care that you engage with in minutes or hours or days. It's really care that's meant for months. It's care for people that are struggling with an advancing illness, and their caregivers need psychological support, emotional support, caregiving support. The patient is looking for management of symptoms. Again, the goal is to stay out of the hospital. The goal is comfort and quality of life. So there are care options. Again, palliative care, more upstream in an illness, hospice care when somebody has advancing illness. And the goal of both programs is symptom management to improve quality of life. And since we're talking about caregiving and self-care today, when someone's in palliative care or hospice care, of course, we're worried about the patient, the individual that's ill. But as caregivers, we're worried about ourselves, right? We're worried, are we doing the right thing? Do we have the network to ask questions? Do we know what to do? Do we feel confident in providing care? We might want the ability to call some experts 24/7 if we have a question. We want to be sure that we're doing everything we can, that we're honoring our loved ones' wishes, but at the same time, we recognize that we need support too, and we need to be sure that we're accessing all the right care, all the resources that we're entitled to, and that we're getting help from the experts. So again, we talked a little bit about the differences between hospice and palliative care. Again, think of palliative care as being care for anybody that's struggling with symptoms associated with serious illness. Hospice care also includes palliative care because hospice is very much focused on symptom relief. But hospice is for somebody with life-limiting illness, whereas palliative care can be at any stage of illness. Our goal is to get the right care to patients and families at the right time. So the mission of Hospice and Palliative Care Buffalo is to provide care, education, support, advocacy to those impacted by serious illness and loss. Believe it or not, right here in our own community, right here in Western New York and Erie County, we're caring for about 1,000 to 1,100 patients right now per day. We provide care and support anywhere home is, whether that's assisted living, whether that's a nursing home, whether that's in a private residence. We typically, of course, with COVID, this has changed a bit, but we're typically having about 900 volunteers that are assisting us with events, with fundraising, with administrative support, but truly, we have volunteers, many volunteers that are assisting caregivers, that are running errands for caregivers, that are taking those that have illness to a doctor's appointment. So we have volunteers that are assisting in our care. We have the Wilson Support Center, which offers grief support and education to anyone that's experiencing grief and loss. And we have our Hospice Foundation. Donations from community members help to enrich and provide additional support services to people that are in hospice and palliative care. And we have lots of programs, again, to support patients, but also to support caregivers. So I guess as caregivers and or patients, we need to remember that at any point in an illness, we can advocate for ourselves and we can advocate for our loved ones. We always want to be sure that we're asking all those that are involved in our healthcare about care options, about support options, about resources. You need to know that anyone can refer to hospice, to palliative care. Anyone can call and ask for information and assistance, and they'll get guidance. You can always ask someone to review someone's medical information, of course, with the patient's permission and their loved one's permission. to request a review and to discuss what are the options out there. Are there more resources? What will my insurance cover? And you certainly can schedule a free in-home or virtual consultation if you have someone with serious illness. So we all know that caring for ourselves and caring for a loved one with illness, it is not easy. And I think we're even more aware of that than ever before. The difficulties of caregiving certainly take a toll on all of us. We've reviewed some ways today to help mitigate some of the exhaustion, some of the frustration and agitation, and some of the difficulties that you encounter as a caregiver. Remember, as a caregiver, you need to exercise self-care, actually self-preservation, right? Great resources. And Katie certainly knows, because of setting up University Express, the Erie County Caregiver Coalition is a wonderful resource. All types of information and resources for all of you. There's the Family Caregiver Alliance, the National Alliance for Caregiving, the National Family Caregivers Association. There are a lot of resources out there. I urge you, when you do need help or you do have questions, there are people that you can ask that can help guide you. When we have loved ones that have serious illness, just navigating the questions, the resources, the options can be overwhelming in and of itself. And that's why having these conversations, and that's why exploring all of your options is always a great thing. Again, be mindful that there are caregiver support groups. Be mindful that we have a lot of resources in our own county. Be mindful that your physicians and the team in your physicians' offices often have a lot of supportive resources to you. And certainly, if you have a loved one that has serious illness, you can call us at Hospice and Palliative Care Buffalo at 686-8000. I think know us before you need us. I think know about resources and options and help out there before you need it, or if you're starting to sense there's a change in your needs or your loved one's needs. Again, never too soon to have these conversations. There's a lot of help out there. I don't know if anybody has any questions. I'm happy to entertain any questions, and I'm happy to be a resource to all of you.
Well, thank you, Lynn, so much for that presentation. All of that information is so important.
Thank you, Katie. You know, as I said, we're all going to be faced with illness ourselves and caring for someone that has illness. And there's a lot of great support and resources. I think sometimes the biggest challenge can be that we're afraid to ask, or we don't know who to ask, or we don't know how to ask. Chances are, if you're thinking that you need help, or you're thinking that you need more resources, the chances are that you do. And there are many that are out there to help.
Definitely. And we have some questions and comments here. So the first comment I'm seeing is spending time in my garden allows me to reset.
Oh, I can certainly appreciate that. I love to garden, and I can't wait until the weather is just a tiny bit better, and I will be out there in my garden thinking of you.
I know. This is a good question. I'm not very good at asking for help. Do you have any suggestions here?
You know what? Most of us aren't good at asking for help, and you shouldn't be shy, especially if someone says, I'm thinking of you. Is there anything I can do? The challenge is when someone says that, they don't often express what they mean by that. So chances are someone that's offering to help, you may know. So you may know how they could help. For example, maybe you want to go out and garden. but you're out of mulch or you're out of something, maybe that person would go pick up mulch so that you can concentrate on your self-care today. Maybe someone would be happy to run to the grocery store. Next time you go to the grocery store, Sally, would you mind picking me up bread, milk, and eggs, the usual staples? Because everybody goes to the grocery store. Or maybe someone would run to the pharmacy, or maybe someone would go lend you a book to read. It could be just about anything. What's hard is people often say, I'd love to help, but they don't kind of give you the parameters. But chances are you might know how they could do something that they're able to do for you and something that you really need.
Thanks for that, Lynn.
Yeah, asking for help is tough. But I guess when I think about it, I want to help. And sometimes I'm not always sure what to offer. So, but I will just come up with one or two things that I will offer and say, I'm going to the grocery store tonight. Can I get you anything? Or I'm going to the post office. Do you need me to mail anything? You know, do you want me to mow your lawn? I like to mow the lawn. So whatever the case may be, you might want to ask what you know that is something that they would feel comfortable doing. And really, any little thing can be helpful. Any little thing, especially when we're overwhelmed, we're tired, we're stressed. People really want to help. They're just not sure how to do so.
Lynn, I really liked what you said there because as a person who's willing to help, that gives me an idea of even sharing what I'm willing to do. Like you said, you need me to mow the lawn, so that way it's taking the pressure off of that caregiver. I love that you mentioned that. Thank you.
Yeah, actually, so we had a patient that was in hospice care last year, and he was adamant and a perfectionist when it came to his lawn and his he was very stressed because his leaves hadn't been raked, and he was just, the patient was just really upset about it because he was so meticulous. And so his loved one realized that he was very stressed about it, called, and a hospice volunteer went over and raked his lawn, raked his leaves. And I thought, that's such an easy thing, right? But it brought him so much comfort. So sometimes it's just a simple thing like that that can make truly be meaningful to someone.
Definitely. Thanks for sharing that with us.
Mm-hmm.
The next person is saying, I find my friends have pulled back, but I enjoy my support group.
So I'm glad you enjoy your support group, because what's wonderful about a support group is oftentimes there might be somebody that doesn't really walk in our shoes, but maybe is having somewhat of a similar journey. Our friends, though, they want to support us and want to try to understand. Sometimes they can't. And I guess in those instances, they're just not sure what to say. If you feel comfortable, I think sometimes you maybe can say, I just need to talk to somebody. I just need to let this out. I really don't expect you to solve anything, but I just need somebody to hear me. But a support group, I think, sometimes can offer suggestions and resources and true understanding. Not that a friend can't, and not that you don't want to enjoy your friends. But honestly, sometimes there are others that might offer you a bit more respite as a caregiver, because there might be some actual conversations that are offering you tips and suggestions that might be helpful.
For sure. Ooh, this is a good question that just came through. How do I start the conversation?
Oh, that's the doozy. And when you say, how do I start the conversation, that can mean so many things, right? But I guess when you say, how do I start the conversation, any conversation that's challenging is hard to start. And I guess one thing is make sure, if you can, that the time is right, that the person that you need to have the conversation with is comfortable, that you're comfortable, that you're honest. If you're talking about illness, I think now it's easier to talk about illness than it was prior to COVID. And what I mean by that is, again, COVID has touched people that have struggled with illness for years, but it's also touching people that have been healthy, that we would never dream would have so many challenges. So I think now to say, we've all experienced so much loss. We've all experienced so much illness. And I, as your caregiver, as your loved one, want to make sure that if ever we encounter something like this, that we're prepared to help you and to make the right decisions. And I honestly don't know that I'm prepared to do that. Can we talk about that? Can we talk about what you think you would want or not want? Can we talk about how I can provide care? Can we talk about too that I'm a little bit overwhelmed as your caregiver? So let's talk to our doctor, or let's talk to a specialist. Let's make sure that we're doing all the right things so that you feel comfortable, but that I, as your caregiver, am armed with all the information that I need to do the right things. I would always encourage everyone to be sure, anybody 18 years of age and older should obviously have a healthcare proxy, someone that could make healthcare decisions if we're unable to make them ourselves. But if I'm a healthcare proxy, so Katie, if I were your healthcare proxy, boy, to have that job, to be sure that I'm doing all the right things, I would have to have a long conversation with you. I would have to be close to you, understand your preferences. Sometimes healthcare proxies are a family member, sometimes they're not. But at the very minimum, as a caregiver, as a loved one, we all should have a healthcare proxy. We should all have conversations with our loved ones about what our preferences would be. We should all talk about caregiving. Being open and honest is so important. And these conversations, frankly, while most of us think of them as a burden, they're really a gift. It's really a wonderful thing to talk about these things, again, prior to a crisis. Because to have such conversations in a hospital and having to make sometimes quick decisions in minutes is really tough if you don't have that foundation. So if you have to have a difficult conversation, I would say, I love you and I want to be sure I'm doing all the right things. And I know you're worried about me, but I'm worried about you. So can we talk about that?
Lynn, what you shared is so powerful. The importance of those conversations and when to have those. My goodness, so important.
Yeah.
Not seeing any other questions right now, so we'll just give it a second here to see if anyone has any last minute things they'd like to share. Is there anything else you want us to know about your agency while we're waiting here, Lynn?
Well, first of all, I'd like to say anyone that is a caregiver, and most of us are, really appreciate yourself. Take time for yourself. Make sure, again, as the flight attendant says, put on your oxygen mask so you can help someone else. So thank you to everyone that's a caregiver. Don't be shy to have conversations. Certainly call Hospice and Palliative Care Buffalo if you have a loved one that has serious illness. And you may not even need help and support now, but to have the resources, to have the questions, to know what to do, where to call, how to get help when help is needed. It's never too early to ask for help. And try to have honest conversations with your loved ones, and take some time for yourself. Garden, have your cup of coffee, read a book, take a quick walk, and don't hesitate to ask those that are offering support. Please give them ideas on how they can help you, because most people, when they offer it, truly do mean it.
For sure. Thank you for all of that, Lynn. We'll have Anna Van Deen from the same agency back with us on June 3rd at 2 p.m. for Coping with Grief and Loss. So we hope you'll join us then. And now, Lynn, I'm just seeing, thank you so much for the information today. This was really informational. Thank you for your time. So glad you're here, Lynn. Thank you.
Thank you, Katie, and thank you, everyone. Have a wonderful day and take some time for yourself today.
Definitely. Take it easy.